Question 1. A pediatric nurse is preparing to administer oral digoxin to a 2-year-old. Which approach by the nurse is likely to have the best outcome? A. Do you want a spoon or a little cup today? Limited choices can help young children feel in control. Letting them choose between two things, such as a cup or a spoon, can increase cooperation. Don't rush children or make them feel as if they have no choice. Also, don't offer too many choices, or else the child will become overwhelmed. Question 2. A client begins to show signs of early tardive dyskinesia, TD. The nurse understands that TD is likely a side effect of taking which type of medication over a long period of time. C. Neuroleptics. Tardive dyskinesia, TD, is a disorder that involves involuntary movements. Tardive means delayed and dyskinesia means abnormal movement. The primary symptom of tardive dyskinesia is involuntary facial movements, grimacing, frowning, pursing the lips, chomping or chewing, sticking out the tongue, and excessive eye blinking. Neuroleptic drugs, also called antipsychotics, that are taken long-term can cause TD. Common medications include chlorpromazine, flufenazine, haloperidol, perfenazine, prochlorperazine, thioridazine, and trifluoperazine. Other classes of medications that can cause TD are antidepressants, amitriptyline, fluoxetine, phenelzine, sertraline, trazodone, anti-seizure drugs, phenobarbital and phenytoin, and antiparkinsonian drugs, levodopa. Bisphosphonates are given to treat osteoporosis and bone loss. Antiretrovirals are given to people with an HIV infection. Antihypertensives are given to treat high blood pressure. Question 3. When a provider prescribes sodium polystyrene sulfonate, Kayexalate, for a client, the nurse can expect the client's subsequent lab values to show B. A decrease in serum potassium. After administering sodium polystyrene sulfonate, Kayexalate, the nurse can anticipate a decrease in serum potassium. The expected response of sodium polystyrene sulfonate is secondary to the binding of this drug and potassium in the colon, and potassium is removed through the feces. The other laboratory outcomes are not related to administration of Kayexalate. Question 4. The healthcare provider, HCP, prescribes isotretinoin for a client with severe acne. When the nurse reviews the client's current medications, which one will cause the nurse to contact the HCP? B. Vitamin A. Isotretinoin is a form of vitamin A. The medicine is part of a class of drugs called retinoids and is used to treat severe acne that does not clear up after using other medications. Clients should be instructed to avoid taking vitamin A or supplements with vitamin A when using isotretinoin. Serious side effects linked to isotretinoin are similar to those seen in patients taking high doses of vitamin A. These include rashes, drowsiness, nausea, abdominal pain, vomiting and headaches. Chronic toxicity can lead to liver or kidney damage. Question 5. The provider prescribes 1 L of lactated ringers to be infused over 6 hours. The infusion set delivers 10 GTTS/ml. How many GTTS/minute is the flow rate? C. 28 GTTS minute. 1. Convert 1L to ml equals 1000 milliliters. 2. Convert 6 hours to minutes equals 360 minutes. 3. 1000 milliliters per 360 minutes equals 2.777 milliliters per minute, round up to 2.8 milliliters per minute. 4. Multiply by the delivery rate of 10 GTTS ml. 10 GTTS ml times 2.8 ml minute equals 28 GTTS minute. The nurse should set the flow rate for 28 GTTS minute. Question 6. The nurse is monitoring an infusion of D5 0.45% NS at 120 milliliters per hour. The drop factor is 15 GTTS ml. What drip rate should the nurse set the for pump at? Round to a whole number? B. 30 GTTS minute. Formula: drip rate in GTTS minute equals total ml divided by total minute, x drip factor in GTT ml. For this question, Step 1. Convert 1 hour to 60 minutes. Step 2. 120 milliliters divided by 60 minutes equals 2. Step 3. X is equal to 2 times 15 GTTS. Step 4. X equals 30 GTTS. To calculate the drip rate, you need to know the calibration for the selected for tubing. Different for solution sets deliver fluids at varying amounts per drop. The drip factor refers to the number of drops per milliliter of solution calibrated for the administration set. Question 7. A client receives a new order for levothyroxine, Synthroid, 150 micrograms PO every day. The pharmacy sends Synthroid 0.1 milligrams tablets. How many tablets will the nurse administer? B. 1.5 tablets. 1. Convert mcg to milligram. 150 mcg 1000 equals 0.150 milligrams Synthroid. 2. Calculate and solve. 0.150 milligrams divided by 0.1 milligrams times 1 tablet equals 1.5 tablets, 1.5 tablets. Question 8. The nurse is giving a presentation on arthritis at a community center. When providing information about the use of nonsteroidal anti-inflammatory drugs, NSAIDs, and how to minimize adverse effects, which instruction should the nurse include? C. Always take NSAID with food or milk. NSAIDs may increase the chance of serious stomach and bowel side effects, such as ulcers and bleeding. And NBSB. Common NSAIDs are aspirin, ibuprofen, and naproxen sodium. They are available as over-the-counter, OTC, drugs. Note: acetaminophen is not NSAID. Other side effects are generally gastrointestinal, gas, bloating, heartburn, stomach pain, nausea, vomiting, diarrhea, or constipation. GI symptoms can be relieved by taking the drug with food or milk or taking an antacid. NSAIDs, except aspirin, can increase the risk of a heart attack or stroke and should be taken for as short a time and as low a dose as possible. NSAID use should be monitored for adverse reactions, which can be sudden and fatal. Vitamin K foods are limited in anticoagulant therapy. Question 9. The pediatrician orders cefalexin monohydrate 0.5 GPO Q8 hours for a child with a diagnosis of pneumonia. The pharmacy sends the medication with 500 mg per teaspoon. How many ml should the nurse administer for each dose? B. 5 milliliters. To calculate the correct dose, first convert to equivalent units. 1 g equals 1000 milligrams, 1 teaspoon equals 5 milliliters. For this question, 0.5 g is equal to 0.5 by 1000 milligrams equals 500 milligrams. The nurse will administer 5 milliliters, 1 teaspoon, per dose. Question 10. Which of the following medications works by inhibiting platelet aggregation? B. Aspirin. Aspirin inhibits the enzyme COX-1, which produces thromboxane A2, which is necessary for platelet aggregation. Aspirin is one of the oldest drugs in the world, going back to ancient times. Warfarin, Coumadin, blocks vitamin K-dependent clotting factors. Heparin increases the effect of antithrombin to inhibit thrombin activation. Neomycin is an antibiotic. Question 11. The provider has prescribed lorazepam, Ativan, for milligrams 4 for a client. Which of the following would require the nurse to contact the provider before administering the medication? C. The nurse is unable to arouse the client. Lorazepam, Ativan, is a benzodiazepine. It is contraindicated for clients who are comatose, who cannot be aroused or awakened, who have pre-existing CNS depression, who are psychotic, who have severe pain, or who have narrow-angle glaucoma. Studies have shown that lorazepam does not affect the cardiorespiratory system or diabetes mellitus. Contacting a provider about administration is not appropriate. The normal respiratory rate for an adult is 12 to 20 breaths per minute. Question 12. A client with a diagnosis of bacterial pneumonia is receiving erythromycin 500 mg POQ 6 hours. Which common side effect may be anticipated? C. Nausea and vomiting. Nausea, vomiting, and diarrhea can occur with antibiotic therapy because the intestinal biodome is disrupted. Clients can be encouraged to eat foods with prebiotics, probiotics, fiber, as well as fermented foods. Other common side effects include abdominal cramping or discomfort, and loss of appetite. Muscle weakness can indicate hyperkalemia. Brisk tendon reflexes, hyperreflexia, is associated with a lesion above the level of spinal reflex pathways. Weight gain is not a side effect of erythromycin. Question 13. A client who takes ibuprofen, Advil, Motrin, 400 mg PO kit for a diagnosis of rheumatoid arthritis calls the clinic. The client's neighbor told the client that the dosage is incorrect, which made the client concerned. What is the nurse's appropriate response? C. This is a normal dose for your diagnosis. The normal oral adult dosage for ibuprofen, Advil, Motrin, is 200 to 400 mg, 3 TID, or 4 KID, times a day. This dosage is typical for pain and fever, with a maximum of 1,200 mg per day. Rheumatoid arthritis generally requires higher doses. This client's dosage is within a therapeutic dosage range of 1200 to 3200 mg day. Question 14. A female client comes to the OB/GYN clinic with a complaint of repeated vaginal infections. An assessment shows that she has candidiasis caused by Candida albicans. What does the nurse anticipate as the treatment for this client? A non-prescription antifungal medication. Candida albicans is treated with an antifungal medication, which can be purchased without a prescription. The antifungals miconazole and clotrimazole are available as creams, vaginal tablets, or vaginal suppositories. Douching is both irritating to the vagina and ineffective. Antibiotics are not used to treat yeast infections. In fact, they are often the cause of vaginitis. Question 15. According to the Controlled Substances Act, all of the following are Schedule II drugs except B. Marijuana. In the United States, the Controlled Substances Act was enacted in 1970 to try to protect the general public from potentially dangerous and addictive drugs. The Controlled Substances Act has 5 schedules of regulated drugs. Schedule II drugs have a high risk of developing a substance abuse disorder. Included in the Schedule II classification are cocaine, morphine, hydrocodone, Vicodin, hydromorphone, Dilaudid, oxycodone, OxyContin, Percocet, meperidine, Demerol, fentanyl, methadone, dextroamphetamine, levoamphetamine, Adderall, and methylphenidate, Ritalin. Marijuana is a Schedule I drug, considered to have no accepted medical use in the United States. Question 16. The nurse in the ophthalmology clinic is instructing a client on the use of timolol maleate, Timoptic. Which of the following statements by the client would indicate a need for further education? C. I'll be able to quit these drops when my eye pressure goes down. Timolol maleate, Timoptic, and NBSB, is a beta-adrenergic blocking agent, used to treat high pressure inside the and NBSB, eye caused by open-angle type glaucoma or other and NBSB, eye and NBSB, diseases such as ocular hypertension. Lowering high pressure inside the and NBSB, eye and NBSB, results in reduced production of the liquid, aqueous humor, within the eye, which helps prevent blindness. There is no cure for the conditions treated by timolol maleate, so treatment is lifetime. The other statements are all correct. Question 17. A client phones the clinic to express concern because the client's tongue turned black after taking a dose of bismuth subsalicylate. What is the nurse's correct response? A. This is a normal and harmless reaction. Bismuth subsalicylate and NBSB winking sad smiley. Common brand names: Bismarex, Bismutrol, Kaopectate, Colapectin DS, Peptic Relief, Pepto-Bismol, Percy Medicine, and pink bismuth, is used to treat diarrhea, nausea, heartburn, indigestion, gas, and upset stomach. A common and harmless side effect is a darkened or black tongue, which will go away when the medication is stopped. Other common side effects are dark stools and constipation. After reassuring the client, the nurse can ask why the client is taking the medication and let the client know that the stools will also be black. This medication is a salicylate, in the same class as aspirin, with similar side effects, bleeding, tinnitus, and contraindications. To reduce the risk of Ray's syndrome, salicylates should never be given to children or teens for viral illnesses. Question 18. A provider has prescribed nicardipine, Cardene, for a client with a diagnosis of hypertension. The nurse knows that calcium channel blockers lower blood pressure by A. Vasodilation and decrease in systemic peripheral resistance. The mechanism of action of calcium channel blockers is vasodilation and decrease in systemic peripheral resistance. Both factors must be present to result in lower blood pressure. If only one, either vasoconstriction or systemic peripheral resistance, is present, hypertension will persist. Question 19. When administering a Mantoux tuberculin test, what type of injection is used? C. Intradermal. The Mantoux tuberculin test is administered by intradermal injection into the dermis, the skin layer underneath the epidermis. Subcutaneous injects are administered into the fat layer underneath the skin. Intramuscular injections are administered into the muscle. Intravenous injections are administered into veins. Question 20. The purpose of administering atropine preoperatively is: C. To decrease secretions. Atropine is an anticholinergic drug, commonly administered to decrease saliva, mucus, or other secretions in the airway during surgery. During anesthesia, it helps maintain regular sinus rhythm. The other answer options are incorrect. Question 21. A provider prescribes an isotonic intravenous 4 solution for a client. Which of the following is an isotonic solution? B. 0.9% sodium chloride. Sodium chloride, normal saline, D5W, and lactated ringers are isotonic solutions. Hypertonic solutions include 5% dextrose in normal saline, D5NS, D5NaCl, or D5 0.9% NaCl, D5 in lactated ringers, D5LR, and 5% dextrose in 0.45% normal saline, D5 0.45NS, D5 0.45 NaCl, or D5 0.45% NaCl. Hypotonic solutions include 2.5% dextrose in normal saline, D2.5NS, 0.25 NaCl, or D2.5 NaCl, 0.45 NS, 0.45% NaCl, and 2.5W, 2.5% dextrose in water. Question 22. After starting and for infusion of an antibiotic, the nurse observes that the client has developed a rash on the chest, neck, and face. The nurse recalls that red man syndrome is caused by which antibiotic? B. Vancomycin. The most common adverse reaction to the drug vancomycin is red man syndrome, also known as red neck syndrome. The name comes from the intense red rash that develops on the face, neck, and torso of affected people. The rash usually appears within 10 to 30 minutes after starting an infusion of vancomycin. Overstimulation of specific immune cells, mast cells, is associated with allergic reactions. The mast cells produce large amounts of histamine, causing the symptoms of the syndrome. The main risk factor is infusing vancomycin too quickly. The solution should be infused for at least 1 hour. Question 23. A nursing instructor is observing a student nurse caring for a client with stage 4 metastatic cancer. After the client receives oxycodone 10 mg PO for complaint of pain, which finding by the student nurse should be reported immediately? B. Respiration rate of 10 breaths per minute. The student nurse should immediately report a respiratory rate of 10 breaths per minute. Normal respiratory rate for an adult is 12 to 20 breaths per minute. Pain from cancer is a major fear for clients. About 25 to 30% of recently diagnosed clients report pain. In advanced stages, 70 to 80% report pain. Nearly 90% of clients with bone metastasis experience pain. The World Health Organization, WHO, recommends pain management is based on client needs. However, opioids are considered the gold standard. MD Anderson Cancer Center lists a dose of oxycodone 8 to 10 mg PO for pain. Adverse effects of oxycodone include slow or shallow respirations, sleepiness, nausea, vomiting, stomach pain, dizziness, lightheadedness, headache, dry mouth, and sweating. Question 24. The healthcare provider, HCP, prescribes buspirone 10 mg PO BID for a client with an anxiety disorder. When the nurse explains the medication to the client, all of the following statements are true except A. You should start to feel less anxious in a day or two. Buspirone is a medication for anxiety, anxiolytic, that works by affecting certain natural substances in the brain, neurotransmitters. Buspirone is taken at the same time every day. It can be taken with or without food, but must always be taken the same way, because drug absorption is affected. Avoid grapefruit juice, it can increase the risk of side effects. Alcohol can cause sedation and sleepiness. Clients should know that it will take 2 to 4 weeks before they experience an improvement. Most clients tolerate buspirone well. It has milder side effects than other anti-anxiety drugs. Question 25. The clinic nurse reviews a new client's over-the-counter, OTC, medications with the client. If the client admits to epigastric pain, which medication is likely the cause? A. Aspirin, taken for osteoarthritis. Although aspirin, ASA, has analgesic, anti-inflammatory, antipyretic, and antiplatelet benefits, it is also a gastric irritant. It should be taken with food, milk, or a full glass of water. Enteric-coated or buffered forms will reduce gastric irritation and the risk of bleeding. The other choices are not associated with gastric irritation. Question 26. During an appointment at the pediatric clinic, the nurse asks a mother about her daughter's control of her asthma. Which statement by the mother would be most concerning to the nurse? C. She has to use her rescue inhaler 4 times during an attack. Using an inhaler 4 times during an attack is concerning. An inhaler can be repeated up to 3 times, 20 minutes apart. If the child is still having symptoms, they should seek medical attention, because it is an indication that the asthma is not well controlled. And NBSB, 90 and NBSB % is a high reading. Using an inhaler 1 to 2 times per week indicates that the asthma is controlled. Taking short breaks during vigorous activity is not concerning as long as the client recovers well. Question 27. A pediatric nurse is educating the parents of a child with cystic fibrosis on how to administer pancreatic enzyme capsules. Which of the following instructions should the nurse include? C. Give the capsules with every meal or snack. Most people with CF need to take pancreatic enzyme capsules before every meal and snack so their bodies can digest the nutrients. Meals and snacks include breast milk, formula, milk, and nutritional supplements. And NBSB. Most pancreatic enzyme supplements come in capsule form. Inside each capsule are many small enteric-coated beads that contain the digestive enzymes. The capsules should be swallowed whole with liquid. Do not chew or crush them. For small children, the capsules may be opened and sprinkled on an acidic food, such as applesauce. Snacks or small meals may require a smaller dose. Question 28. A provider prescribes triamterene, direnium, for a client with a diagnosis of congestive heart failure. The nurse instructs the client to avoid the following fruits except: C. Pears. Triamterene, direnium, is a potassium-sparing diuretic. It is prescribed for congestive heart failure, liver disease, kidney disease, and edema related to cancer. Unlike other diuretics that deplete potassium, such as furosemide, Lasix, clients taking triamterene should avoid fruits and vegetables that are rich in potassium, such as bananas, strawberries, oranges, avocados, mangoes, cantaloupe, nectarines, and green leafy vegetables. Question 29. The healthcare provider, HCP, has prescribed a unit of packed red blood cells, PRBCs, for a client with anemia. Which of the following nursing actions is appropriate for administration of the PRBCs? B. Transfuse the unit of PRBCs over a maximum of 4 hours. Blood should be transfused within 4 hours of leaving the controlled storage temperature to prevent damage or bacterial growth. Transfusion should be immediately stopped if the client exhibits any signs or symptoms of a reaction. Vital signs are taken every 15 minutes for the first hour of the transfusion, when a reaction is most likely to occur. If there are no signs of a reaction, vital signs can be monitored every 30 to 60 minutes, according to policy. Blood should leave the blood bank when ready to be infused and never stored in an unapproved refrigerator. Question 30. A diabetic patient receives 10 units of regular insulin and 20 units of NPH insulin each day after breakfast. After following normal preparation steps for administering insulin, what should the nurse do next? C. Draw up regular insulin first, because it is clear. Regular, short-acting, insulin is clear. NPH, intermediate-acting, insulin is cloudy. Giving one injection is more efficient and comfortable for the patient. Remember the mnemonic, RN, regular to NPH. The correct procedure for administering short and long-acting insulins together is as follows. 1. Verify orders for insulin types and doses. 2. Wash hands and put on gloves. 3. Roll NPH, cloudy, Insulin between palms to mix contents of the vial. Do not shake. 4. Clean tops of vials with alcohol prep for 5 to 10 seconds. 5. Inject 20 units of air into NPH vial and remove syringe. 6. Inject 10 units of air into regular, clear, vial and withdraw 10 units. Remove syringe. 7. Insert syringe into NPH, cloudy, vial and withdraw 20 units. 8. Administer immediately. Within 5 to 10 minutes, combined insulins may be affected. Question 31. Following a myocardial infarction, a client receives a prescription for Docusate. The client is hesitant to take the medication, telling the nurse, "I don't want another pill. Besides, I'm never constipated." What is the nurse's best response? A. This will make sure your stools are soft and easy to pass. Docusate sodium is a stool softener. It works by increasing water absorption in the gut, making stools softer and easier to pass. Docusate is often used when straining to have a bowel movement should be avoided, e.g., after a heart attack or surgery. It is taken by mouth, usually at bedtime, with a full glass of water or juice. Docusate has no effect on cardiac medications. The Valsalva maneuver increases intrathoracic pressure. It can put an unhealthy strain on the heart and raise blood pressure, so should be avoided with a diagnosis of cardiac disease. Question 32. A 42-year-old client with a diagnosis of tuberculosis has been taking isoniazid for 2 months. Which laboratory test is most important for the nurse to monitor? B. Liver function panel. Severe and sometimes fatal hepatitis associated with isoniazid therapy has been reported and may occur or develop even after many months of treatment. The risk of developing hepatitis is age-related. For persons 35 and older, in addition to monthly symptom reviews, hepatic enzymes, specifically AST and ALT, formerly SGOT and SGPT, respectively, should be measured prior to starting isoniazid therapy and periodically throughout treatment. Isoniazid-associated hepatitis usually occurs during the first 3 months of treatment. Liver function tests should be performed prior to starting isoniazid therapy to establish a baseline. Sputum cultures may be performed during treatment as evidence of drug efficacy, not to assess adverse effects of the drug. Renal and cardiac tests are not directly related to the isoniazid therapy. Question 33. The nurse is reviewing the results of a client's phenytoin, dilantin, level. Which of the following results would put the client at risk for seizure activity? B. 8 micrograms per milliliter. In clients with normal renal function, the therapeutic range for phenytoin, dilantin, is 10 to 20 mcg/ml. Levels below 10 micrograms per milliliter put the client at risk for seizure activity. Levels above 20 micrograms per milliliter put the client at risk for toxic adverse effects. In either of these situations, the nurse should notify the provider so that the medication dosage can be adjusted. Question 34. The nurse has volunteered to administer COVID-19 vaccinations at a public health clinic. Doses are drawn from a multiple dose vial. Which of the following methods is correct when withdrawing a medication from a multiple dose vial? pull back plunger to the line on the syringe that equals the desired dose and inject into the vial. To withdraw medication from a multiple dose vial, 1. Wipe the rubber top with an alcohol pad. 2. Hold the syringe like a pencil, with needle pointed up, cap on. 3. Pull back the plunger to the line on the syringe that equals the desired dose. This fills the syringe with air. 4. Remove the cap and insert the needle into the rubber top. 5. Push the air into the vial. This prevents formation of a vacuum. 6. Turn the vial upside down. Keeping the needle tip in the solution, pull back plunger to the line on the syringe that equals the dose. Injecting 1 milliliter of air may not be adequate for the prescribed dose, and it will be difficult to withdraw the drug. Too much air will force the needle out of the vial. Withdrawing the entire volume for a single dose is wasteful and incorrect. Question 35. When administering total parenteral nutrition, TPN, for the first time, what is the typical infusion rate? C. 50% of the prescribed infusion rate. TPN should be started slowly, at 50% of the prescribed infusion rate. Because of the possible complications, including hyperglycemia and electrolyte imbalance, the client must be closely monitored while their body adapts to the TPN formula. Question 36. The nurse will administer 1 L of normal saline over 10 hours. No infusion pumps are available. The 4 tubing has a drop factor of 20 GTTS/ml. How many drops per minute should be infused? Round to a whole number? A. 33 GTTS minute. The nurse should count 33 GTTS minute. Step 1. Convert 1 L to 1000 milliliters. Step 2. Total volume 1000 milliliters divided by 10 R equals 100 milliliters per hour. Step 3. Hourly infusion rate 100 milliliters per hour divided by 60 minutes equals 1.66. Step 4. 1.66 by 20 GTTS/ml equals 33.33 GTTS minute. Question 37. The pediatrician has prescribed heparin therapy for a child. Before the nurse administers the first dose, which assessment finding is most important? D. Weight in kilogram. The dosage of anticoagulant therapy in children is calculated on the basis of weight-based calculation, of units kilogram. Other medications in children are dosed according to body weight, milligram kilogram, or body surface area, BSA, milligram m squared. Care must be taken to properly convert body weight from pounds to kilograms. 1 kilogram equals 2.2 pounds, before calculating doses based on body weight. Doses are often expressed as milligram kilogram day or milligram kilogram dose. Therefore, an order written as milligram kilogram D is ambiguous and will require further clarification from the prescriber. Question 38. Postoperative orders for a client include meperidine hydrochloride 50 mg IMQ 4 hours PRN. The drug is supplied in ampules of 100 mg per milliliter. How much will the nurse administer in each dose? D. 0.5 milliliters. To calculate the correct dose, divide the desired dose by the amount on hand and then multiply by the volume. DH times V, for this question, 50 mg divided by 100 mg times 1 milliliter equals 0.5 milliliters. Question 39. A client with a diagnosis of septic shock is in the ICU. The provider has ordered 4-hydrocortisone 50 mg q6 hours. Which serum lab value will the nurse anticipate? D. Increased glucose. Hydrocortisone, Solucortef, belongs to a class of drugs called glucocorticoids, or steroid hormones. One of their side effects is to increase blood glucose, sugar, because these drugs promote glucose production in the liver and reduce the sensitivity of the cells to insulin. Hydrocortisone has little or no effect on serum magnesium levels. Question 40. A client is prescribed glipizide, glucotrol, 5 mg every morning. The nurse educates the client that the purpose of this medication is D. To reduce blood glucose. Glipizide, glucotrol, is an oral diabetes medication that helps control blood sugar levels by stimulating the pancreas to produce insulin. Glucotrol is used together with diet and exercise to improve blood sugar control in adults with type 2 diabetes mellitus. In general, the starting dose is 5 mg taken daily, 30 minutes before breakfast. Glucotrol and NBSB is not for treating type 1 diabetes. Question 41. Lyme disease should be treated promptly. When a patient presents to the emergency department with symptoms related to Lyme disease, which of the following should be prescribed? D. Doxycycline. Doxycycline and amoxicillin are the usual prescriptions for Lyme disease. Enalapril, Vasotec, is prescribed for hypertension and congestive heart failure. Famotidine, Pepcid, is used for gastrointestinal disorders. Simvastatin, Zocca, reduces cholesterol. Question 42. The home health nurse visits an 82-year-old client who has been taking hydralazine, apresoline, 20 mg POQM for 3 years without incident. Today, an hour after taking it, the client's blood pressure is 76/44. When the nurse assesses the situation, which of the following is the most significant finding regarding the client's hypertension? D. 24-hour intake has been 750 milliliters. Inadequate fluid intake when taking vasodilator medications can cause a drop in blood pressure. Weak or thready pulses and tachycardia are indicators of hypertension. Serum potassium of 3.6 millimoles per liter is at the low end of the normal range of 3.5 to 5.0 millimoles per liter and is not associated with low blood pressure. Question 43. A provider prescribes 8.0 mg IM of a medication. The pharmacy sends a vial labeled 10 mg per milliliter. How much of the medication will the nurse draw up in the syringe? D. 0.80 milliliters. The formula is as follows: desired available times volume equals ml per dose. For this question, 8.0 mg per 10 mg times 1 milliliter equals 0.80 milliliters. Question 44. A nurse is preparing to administer bethanical, uricline, to a client with a diagnosis of neurogenic bladder secondary to Parkinson's disease. Which of the following is correct when the nurse administers the medication? D. Should be given on an empty stomach. Bethanical, uricline, is prescribed for a client who is unable to urinate or empty the bladder. It should be taken on an empty stomach, 1 hour before or 2 hours after a meal, to decrease the risk of nausea and vomiting. It is never administered by 4 or IM routes. For the best outcomes, bethanical should be taken on a regular schedule. It can cause a drop in blood pressure, so it may not be appropriate for clients who already have some type of hypertension. Question 45. A client who has been receiving a transfusion of packed red blood cells, PRBC, for 3 hours tells the nurse that they are experiencing shortness of breath and an itchy, raised rash. The nurse also notes that the client is anxious and restless. Which type of transfusion reaction does the nurse suspect? D. Allergic transfusion reaction. This client is experiencing an allergic transfusion reaction, characterized by dyspnea, wheezing, and urticaria, hives. A hemolytic transfusion reaction is indicated by fever, chills, chest pain, hypertension, and tachypnea. Signs and symptoms of a febrile transfusion reaction include fever, chills, and headaches. This is a non-hemolytic reaction. A delayed hemolytic reaction occurs at least 24 hours, typically 2 to 10 days, after a transfusion, due to alloimmunization from a previous transfusion. Question 46. Which type of insulin can never be mixed with another? D. Long-acting. Insulins are prescribed and administered for varying purposes. Some insulins, such as rapid, regular, and intermediate, are often given together. However, long-acting insulins, such as insulin glargine, Lantus, cannot be mixed or given simultaneously with another insulin, because the results would be unpredictable. Slow-acting insulin that works over 24 hours is carefully calculated. Any other insulins would interfere with its actions. Question 47. A client phones the clinic to ask which over-the-counter, OTC, medications to take when traveling. The nurse suggests including loperamide, Imodium, to relieve which condition? D. Diarrhea. Loperamide, Imodium, is used for both acute diarrhea, such as with traveler's diarrhea, and chronic diarrhea, such as with inflammatory bowel disease. It is also used to reduce the amount of stool in clients with an ileostomy. Imodium slows movement in the gut, decreasing the number of bowel movements and making the stool less watery. Question 48. The nurse checks a client's intravenous infusion of an antibiotic and notes it is running slower than anticipated. The client is scheduled for a peak blood level to be drawn at 1000, but the infusion won't be completed until 10:30. What is the nurse's best action? D. Reschedule the blood draw for 1100. Peak and trough levels are drawn to determine a drug's concentration within the system. They help determine whether a medication is in a toxic range or the dosage needs to be increased. The nurse should reschedule the peak level draw for the appropriate time after the antibiotic has been infused. Peak blood levels are drawn about 30 minutes after completion of the infusion. For oral drugs, peak blood levels are drawn about 60 minutes after ingestion. For intramuscular administration, about 30 to 60 minutes after injection. Trough levels are drawn immediately before the next dose. Question 49. Before administering morning medications to a client with a diagnosis of heart failure, the nurse reviews the AM blood draw results: serum sodium 138 mEqL, serum potassium 2.8 mEqL, and serum digoxin 0.8 nanograms per milliliter. Which of the following medications should the nurse hold until he or she contacts the healthcare provider, HCP? D. Digoxin. The client's potassium K level is low. The normal range is 3.5 to 5.0 mEqL, so the nurse should not administer the digoxin. Hypokalemia can predispose the client to digoxin toxicity. The other three medications can be administered. Although carvedilol can increase plasma digoxin concentration, this client's digoxin level is normal. Amiloride is a potassium-sparing diuretic. This client's potassium level is low, so amiloride can also be given. Ferrous sulfate does not affect these lab values. Normal sodium Na levels are 135 to 145 mEqL. For treating heart failure, the normal level of digoxin is between 0.5 and 1.0 nanograms of medication per milliliter of blood, in ml.